Thank you for your interest in our presentation. I'm Melissa Tovin.
And I'm Annabelle Nunez-Gannard.
Our project is titled Telehealth to Increase Physical Activity and Self-Determination for Young Adults with Autism Spectrum Disorder, a randomized feasibility trial. The number of children with autism spectrum disorder, or ASD, who are transitioning to adulthood each year is rising dramatically. While autism awareness and research initiatives have led to a significant increase in diagnostic and intervention services for children, there is a lag in meeting the health and wellness needs of adults. Previous research indicates diminished participation in physical and recreational activity, low employment rates, and social isolation when compared to typical peers. Barriers such as transportation, cost, and social communication impairments contribute to a sedentary lifestyle and increased risk for overweight and obesity. Previous research on physical activity in adults with ASD indicate that relatedness, a component of self-determined motivation, is lacking in this group, possibly due to impaired social communication. Community-based programs such as the one pictured here implement strategies to strengthen relatedness and build motivation, such as peer-to-peer support. With COVID-19 restrictions, however, community programs like this have been canceled, and these individuals are struggling with a lack of social engagement and physical activity. The objective of this study is to investigate the feasibility of telehealth intervention to improve physical activity levels, fitness, and self-determined motivation to exercise in adults ages 18 to 35 who have a diagnosis of ASD, to ensure subjects would be able to access and utilize telehealth and supporting technologies used in the study. We implemented a vigorous screening protocol. This included the ability to access and complete a 5-item internet survey.
In this pilot crossover study design, subjects were randomly assigned to a treatment group or a waitlist control group. Baseline and post-intervention data were collected via Zoom, which enabled face-to-face interaction and guidance using features such as screen share and chat. Anthropometric measurements included weight, height, and waist circumference to determine BMI and waist-to-height ratio. Subjects completed a baseline demographic questionnaire to determine physical activity preferences, social and environmental support. The Breck 2 and Golden leisure time questionnaires were administered to measure self-determined motivation and self-reported physical activity. Zoom also supported use of stopwatch activity monitors for objective measures of physical activity. Monitors were either mailed or dropped off to subjects' homes, followed by an instructional session on Zoom to ensure correct donning, fit, and use of the stopwatch monitor. So as far as the telehealth intervention, the treatment group received 10 weekly telehealth meetings, individualized exercise programs that were updated at each meeting, and Fitbit activity trackers with step goals. The waitlist control group received Fitbits and individualized exercise programs and initial step goals with no additional telehealth or social support. So far in our preliminary findings, we have 18 subjects enrolled, 11 males, 7 females with a mean age of 26. There were no statistically significant differences in baseline health outcome variables such as BMI and waist to height ratio, although I do want to point out that they were both relatively high. BMI was 28 and waist to height ratio was 0.56. Data analysis indicates that all treatment group subjects have adhered to the intervention protocol, and we're seeing a significant moderate effect with the treatment group having improved daily step counts from baseline to week 7 as compared to the waitlist control group.
We're also collecting qualitative data to understand the subjects' perspectives about telehealth intervention. So far, we've completed 3 focus group interviews with the first cohort who overwhelmingly identified connecting through the weekly telehealth meetings as having the most impact on their motivation and activity level. Although we are still in the process of collecting and analyzing the data, we've made some observations regarding the strengths and challenges of telehealth in this population. The challenges are related to the broadness of the spectrum of autism. Despite methodical screening, we faced individual and group challenges to engagement in telehealth meetings and overall adherence stemming from social communication impairments, impaired executive function, and both skill level and willingness to learn and use the technology.
So in summary, preliminary data demonstrate the feasibility and effect of telehealth intervention in conjunction with a wearable device to promote physical activity and self-determined motivation among young adults with ASD. Thank you for your time, and we look forward to the live poster session.